have an opposed unless amended position on this bill. Unlike past years, we've been working with the author and the sponsors to try and make this bill look more like the federal law, which is the law of the land. We have a couple of issues that we'd like to see addressed in the bill as it's currently written. We're concerned about the provision that would require us to change our underwriting now in 2012 and then again in 2014 when the federal rules come into play. And we also do have some concerns about the third-party review process being a little bit unwieldy in the amount of time it has to actually be in existence before it's irrelevant. Our industry's made significant changes to how we handle rescissions. As the department testified, over the last year and a half, only 9 rescissions from HMOs. We believe that the problem has largely been addressed, but we look forward to working with the author and sponsors and the Department of Managed Healthcare and HHS, which just came out with federal regulations yesterday, which we're still reviewing. Thank you very much.
Jason Gappart with the Association of California Life and Health Insurance Companies. We also have an opposed unless amended position in conjunction with CAP.
Comments from committee? Senator, would you like to close?
On behalf of the Assembly member, I know that he's committed to working with the opposition to try to get some resolution, not accepting these amendments today that have been proposed, but I know that he's wanting to continue working, and on his behalf, I'd ask for an aye vote.
Thank you. Call for the vote, please. Was the motion?
Yes.
Yes. Motion by Senator Grady McLeod.
Senator Alquist?
Aye.
Alquist, aye. Strickland, Onnested, Cedillo, Cox, Leno, Negretti McLeod? Pavley, Romero?
Aye.
Romero, aye.
That bill has 2 votes. It is on call. We need 5. Next, we have another bill by Assemblymember Delatorre. Let's see. This is 3 AB 1225. Senator Negretti McLeod presenting for him.
Thank you, Madam Chair. AB 1225 requires the Department of Public Health or any local public health department conducting preparedness simulations for any infectious disease outbreak to identify deficiencies in their plans and to track the implementation of any needed corrective action. Under the bill, state and local entities would prepare after-action reports within 90 days of an exercise and establish written procedures for the follow-up of recommendations identified in these reports. The reports will be available on the Department of Public Health's website or upon request. In an August 2005 report by the Bureau of State Audits found that while each surveyed local health department participate in preparedness exercises related to infection disease emergency, none included any policy or specific procedure for preparing after-action reports. This bill does not take a minimalist approach to protecting California. Instead, it will compel DPH and local health departments to complete after-action reports in all cases and constantly remain mindful of the corrective actions necessary to truly mitigate threats. I ask for your aye vote, and I have witnesses.
Thank you. Are there witnesses in support? Are there witnesses in opposition?
Good afternoon, Madam Chair and members of the committee. I am Richard Kwong from the California Department of Public Health. The department respectfully opposes AB 1225. We believe that this bill is unnecessary because the role of after-action reports in disaster preparedness is already addressed in emergency preparedness statutes, regulations, and guidelines. CDPH and local health departments receive federal CDC grant funds to prepare for public health emergencies, including emergencies involving infectious diseases. As a condition of receiving the funds, CDC requires CDPH to prepare and implement after-action reports and related corrective action plans for drills, exercises, and actual incidents. Additionally, CDPH has implemented a written procedure for developing AARs and corrective action plans for drills, exercises, and incidents, and posted the procedures on our website for use by CDPH programs, and for these reasons, we oppose AB 1225. Thank you.
Thank you. Is there other opposition? Comments from committee? The bill has been moved by Senator Romero. Closing comments, Senator Negrete-McLeod?
Ask for your aye vote.
Thank you. Call for the vote, please.
Senator Alquist.
Aye.
Alquist, aye. Strickland. Onnested. Cedillo. Cox. Leno. Negrete-McLeod.
Aye.
Negrete-McLeod, aye. Pavley. Romero. Aye.
That bill has 3 votes. It is on call.
Madam Chair, I have the next bill, 1825.
And that is file item 8.
That is file item 8, correct.
AB 1825.
Thank you, Madam Chair and members. Assembly Bill 1825 will require all individual and group health insurance policies regulated under the Department of Insurance to cover maternity services for women in California. This legislation will close a loophole exploited by health insurance companies in order to sell cheap coverage. This measure is similar to AB 98, which was vetoed by the governor last year. While maternity coverage has been included in the National Health Care Reform, the exchanges will not be open for another 4 years. 4 years is the time between Senator Spears' SB 1555 and Assemblymember Delatore's introduction of AB 1962. In that time, the market changed considerably. Already, we've seen a drop in coverage since 2007 from 22% of people being covered in the individual markets to just 19%. Another 4 years will push that many more women out of coverage. Furthermore, we cannot be certain that HHS is going to write regulations that provide the comprehensive coverage that this bill does. Let California lead the way and set example on how to truly protect women and children. A vote for AB 1825 ensures that women will receive the comprehensive maternity they deserve. And with me, I have Shannon Smith Crawley on behalf of the American College of Obstetricians and Gynecology, and Manolo Paltin on behalf of Blue Shield.
Thank you.
Shannon Smith Crowley, American Congress of OBGYNs. This committee has voted this bill out 3 times before. We're back again because, again, we have gone from, in over a 5-year span, 82% of policies containing maternity to 19%. We can't afford to wait another 4 years. I think the chair understands that, and our organization also supports SB 890, where that maternity is considered an essential benefit. But one of the things that's not really talked about is that while most women get coverage by the end of their pregnancies, it's the beginning of the pregnancy that's especially important. If they don't have coverage and they're trying to figure out what they're doing before they figure out that they are entitled to enroll in a state program, they're going without care. This has the potential not only to improve the pregnancy outcomes, but also state costs for when those women turn to AIM at $11,100 a policy, to Medi-Cal, and when the babies are born too early or with problems, that they go to Medi-Cal or California Children's Services. So we think even though that this is partially covered, at least in federal law, that we still need a solution in California, and we ask for your aye vote.
Thank you, Madam Chair. Members, Manolo Platine, Blue Shield of California. As you know, Blue Shield typically doesn't support benefit mandates, but we are supporting this one because we believe maternity services are unique. We believe that maternity services are a fundamental health care need that should always be a part of any insurance coverage. By allowing some policies to exclude maternity coverage, it only exacerbates the existing access and affordability problems, as mentioned by the previous speaker. The effect of allowing insurance companies to offer individual policies without maternity coverage is basically to segregate the risk pools from those needing the fundamental health care into a separate risk pool, which increases their costs. This practice, we believe, undermines the basic concept of insurance, which is to spread treatment costs for the fundamental health care needs across the largest population as possible. For these reasons, Blue Shield proudly supports AB 1825. Thank you.
Beth Capel on behalf of Health Access California here in support.
Beth McGovern on behalf of the California Commission on the Status of Women. We are pleased to be a co-sponsor of this bill, and we urge your aye vote.
Anne-Marie Benitez with Planned Parenthood Affiliates of California in support. Thank you.
Thank you.
Kristen Hare, California Academy of Family Physicians, also in support.
Thank you.
Randy Hicks with Californians for Disability Rights in strong support.
Thank you.
Stephanie Roberson on behalf of the CNA, also in support.
Thank you.
Teresa Stark, California Medical Association in support.
Thank you. Anyone else in support? Opposition?
Jason Gappert with the Association of California Life and Health Insurance Companies. It is our understanding that maternity services will be included in the essential benefits package in 2014 at the federal level. We just don't feel that it's appropriate to have AB 1825 go into effect right now in California before then, given the potential increase in premiums and newly uninsured. For those reasons, we are opposed.
Sherry Lowenstein with the Department of Managed Healthcare. We do have a position opposed on the bill. However, we have informed the author's office that when the federal guidelines do come out defining what the essential benefits are, we'll reconsider at that time. I think one thing that's important to remember when looking at mandate coverage in general, and especially with respect to the federal health reform law, is there are provisions in that bill that essentially would require the state of California to pick up any additional costs in premium beyond what the essential benefits are, would not be allowed to be passed on the consumers for those products in the exchange. So there can be cost effects to the state if we don't pay attention to how they ultimately define essential benefits. Thank you.
Comments from committee?
I ask for an aye vote.
You ask for an aye vote. Bill has been moved by Senator Romero. Call for the vote, please.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Onnested? Cedillo? Cox? Leno? Negretti-McLeod?
Aye.
Negretti-McLeod, aye. Pavley? Romero?
Aye.
Romero, aye.
That bill has 3 votes. It needs 5. It is on call.
It was 4.
Wait a minute, I'm sorry. 4. Wait a minute. You're saying 4 and you said 3. How many? 3. It's 3. Right. Did you vote for it?
I voted for it. I said aye.
Secretary did not have you recorded, so
aye.
let's do it one more time.
Everybody?
Yes.
Senator Ahlquist?
Aye.
Ahlquist, aye. Strickland? Onnested? Cedillo? Cox? Leno? Negretti-McLeod?
Aye.
Negretti-McLeod, aye. Pavley? Pavley, aye. Romero? Romero, aye.
Thank you. That has 4 votes. It is on call. Thank you very much.
Thank you, Madam Chair. And I have the last bill for Assemblymember Delatorre, which is AB 2540, which is 23.
If I could interrupt just for a moment to say that Senator Negretti-McLeod is presenting the last bill, and after we do that, we will have a vote-only bill, the Fuhrer bill, which is file item 26. So I encourage members to come back to committee, and then we will go through the roll of all the bills one more time, and that will be it. So Senator Negretti-McLeod, would you like to present file item 23, AB 2540?
Thank you, Madam Chair. And to start off, I would like to accept the committee's suggested amendments on page 6 of the analysis as an author's amendment, and so that AB 2540 will increase the insurance commissioner's ability to fine health insurers who unlawfully engage in post-claims underwriting. Specifically, AB 2540 would add post-claims underwriting to Insurance Code Section 790.03, which deals with unfair and deceptive acts or practices. Current law prohibits plans and insurers from post-claims underwriting, which includes rescinding, canceling, or limiting a plan or contract due to the plan's failure to complete medical underwriting and resolve all reasonable questions arising from the application. However, if a plan does engage in post-claims underwriting, the Commissioner has the jurisdiction to fine only $118 per violation. While the law prohibits this sort of behavior, it has not deterred the health insurers from engaging in this practice. By increasing the Commissioner's ability to place higher fines on this practice, we can deter the insurers from continuing this practice. I have with me witnesses.
David Link with the Department of Insurance. The $118 penalty was always an anomaly in the law. It doesn't reflect the gravity of this particular offense. We're still trying to drive the number of illegal rescissions down to 0 with our new settlements and our regulations that are now in effect. We urge an aye vote on this bill.
Thank you.
Beth Capel on behalf of Health Access California. Pleased to be here and support all regulatory entities should have effective fine authority.
Jason Gappar, the Association of California Life and Health Insurance Companies. We did have an opposed unless amended position, but with the newly accepted amendments tonight, we're happy to report that we have removed our opposition.
Randy Hicks with Californians for Disability Rights, California Alliance for Retired Americans, in strong support.
Lori Sobel with Consumers Union in strong support.
Witnesses in opposition. Comments from committee? Bill has been moved by Senator Romero. Call for. Oh, would you like to close?
I respectfully ask for an aye vote.
Thank you. Call for the vote, please.
Senator Alquist. Aye. Alquist, aye. Strickland. Honested. Cedillo. Cox. Leno. Negretti-McLeod.
Aye.
Negretti-McLeod, aye. Pavley. Aye. Pavley, aye. Romero. Aye. Romero, aye.
That bill has 4 votes. It needs 1 more vote. It is on call. Members, the last bill is for a vote only. There is no presentation. After that, we will go through the whole list again.
Madam Chair, can you detail the amendments that were taken for that vote only measure?
Certainly. Just a moment. Yes, one of them, yes. Amendments agreed to allow plans and insurers to lower premium rates as long as cost sharing and covered benefits do not change for the enrollee. You may remember the discussion we had last week of do we allow for more times during the year when it can be open, and if you do that, maybe what really happens is that costs really go up instead of going down for the enrollee. So the amendment that I asked for and Assemblymember Feuer has taken is to say as long as the covered benefits don't change, as long as there's the cost sharing that it allows the plans to do this. So it's a positive. Okay, so we are ready to vote on file item 26, Assemblyman Feur's AB 2042.
Move the bill as amended.
Thank you. Call for the vote, please.
Senator Alquist.
Aye.
Alquist, aye. Strickland. Honested. Cedillo. Cox. Leno. Negretti-McLeod.
Aye.
Negretti-McLeod, aye. Pavley.
Aye.
Pavley, aye. Romero.
Aye.
Romero, aye. Let's go 4.
That bill has 4 votes. It is on call. We do need Senator Leno and Senator Cedillo. And since I think we will go through the list now because some of you have been sitting here a very, very, very long time. And hopefully Senators Leno and Cedillo will be here in the next 2 or 3 minutes, and I'm hoping the sergeants will help us with that.
Yeah.
Madam Chair, when you call the vote, can you also signal how the chair has voted?
Yes.
Thank you.
The Perez bill did not have a motion. Pardon me? Item 20 did not have a motion. That was the speaker's bill. So we need a motion on that? Yes. Remind me. Okay, that's the only one I have.
Before we start, Senator Romero asked that I say how I voted, how I, the chair, voted on all these. I voted aye on everything except for file item 9, AB 1858, and the only reason I voted no on that, I believe in the program. I only voted no because I do think because it trumps local government that there ought to be a sunset date and a generous sunset date of 8 years, and the author disagreed, and we just disagree on that point. So however members feel like voting is certainly, as always, up to you. Okay, we ready to? Ready.
You'll give us the vote total.
Yes, we'll give the vote totals on each one.
Do you want me to go? Item 1, AB 2072 by Assemblymember Mendoza. The vote right now is 5-1. She's already said the chair's vote. Senator Strickland, Cedillo,
He said no.
Cox. Well, okay, so it's 5-1 is the vote.
That vote is 5-1.
Item number 2, SB 227 by Senator Alquist. The vote is 3-0. Senator Strickland, Onnested, Cedillo, Cedillo, aye. Cox, Leno, Pavley. Pavley, aye.
That bill has 5 votes. We will hold that open for now also until Senator Leno gets back. Okay.
Item 3, AB 1225 by Assemblymember De La Torre. The vote is 3-0. Senator Strickland, Onnested, Cedillo, Cedillo, aye. Cox, Leno, Pavley. Pavley, aye.
That bill has 5 votes, which is enough, but we will also keep it on. Here comes Senator Leno. Why don't we go back on and start from the beginning, because we're almost, we haven't done very much yet. So okay. Start with file item 1, Mendoza.
He's on 1.
I'm on 1.
Okay, file item 2.
SB 227 by Senator Alquist. The vote is 5-0. Senator Strickland, Onnested, Cox, Leno.
Leno, aye.
Leno, aye. It's got 6.
That bill has 6 votes. It is out. And did we say file item 1 was out?
Yes.
We did say file item 1 was out also.
Item 3, AB 1225 by Assemblymember De La Torre. The vote is 5-0. Senator Strickland, Onnested, Cox, Leno.
Aye.
Leno, aye. 6. It's out.
That bill has 6 votes. It is out.
Item number 4, AB 1503 by Assemblymember Liu. The vote's 3-0. Senator Strickland, Onnested, Cedillo. Aye. Cedillo, aye. Cox, Leno.
Aye.
Leno, aye. Pavley.
Aye.
Pavley, aye. It's got 6.
That bill has 6 votes. It is out.
Item number 5, AB 1600 by Assemblymember Bell. The vote is 2-0. Senator Strickland, Onnested, Cedillo. Aye. Cedillo, aye. Cox, Leno. Aye. Leno, aye. Pavley. Aye. Pavley, aye. Romero.
Aye.
Romero, aye. It's got 6.
That bill has 6 votes. It is out.
Item number 6 was put over by the author. Item 7, AB 1701 by Assemblymember Chesbro. The current vote is 2-1. Senator Strickland, Cedillo. Aye. Cedillo, aye. Cox, Negrete McLeod.
Aye.
Negrete McLeod, aye. Pavley.
Aye.
Pavley, aye. Romero.
Aye.
Romero, aye. 6-1.
That bill has 6 votes. It is out.
Item number 8, AB 1825 by Assemblymember De La Torre. The current vote is 4-0. Senator Strickland, Onnested, Cedillo. Aye. Cedillo, aye. Cox, Leno.
Aye.
Leno, aye. It's got 6.
That bill has 6 votes. It is out.
Item number 9, AB 1858 by Assemblymember Blumenfeld. The current vote is 1-1. Do you want to know if that's the one you voted no on or not?
I did mention that it's the only one I voted no on, yes.
Just on the sunset where the disagreement was.
That was the only place. I believe in the program.
The other 6 amendments were taken.
The other 6 were taken, yes.
Senator Strickland, Onnested, Cedillo. Pardon me? 1-1. Yes. Cedillo, pass. Cox, Leno.
Aye.
Leno, aye. Pavley.
Aye.
Pavley, aye. Romero.
Aye.
Romero, aye. It's 4-1.
That vote is 4-1.
Reconsideration granted.
Reconsideration granted.
Item 10, AB 1872 by Assemblymember Galgiani. The current vote's 3-0. Senator Strickland, Onnested, Cedillo.
I'm sorry, I apologize.
Item 10, AB 1872 by Assemblymember Galgiani. Cedillo, I. Cox. Leno. Leno, I. Pavley. Pavley, I.
It's got 6.
That bill has 6 votes. It is out.
Item number 11, AB 1932 by Assemblymember Hernandez. The current vote is 2-0. Senator Strickland, Onnested, Cedillo, Cox, Leno. Leno, I. Pavley. Pavley, I. Romero. Romero, I. Cedillo, I.
It's got 6.
That bill has 6 votes. It is out.
Item number 12, AB 2000 by Assemblymember Hagman. Testimony was taken and the bill was put over by committee. Item number 13, AB 2084 by Assemblymember Brownlee. The current vote is 2-1. Senator Alquist.
Aye.
Alquist, aye. Strickland. Cedillo. Cox. Pavley. Pavley, aye. Cedillo, aye. Romero. Romero, aye.
6-1.
That bill is out.
Item number 14, AB 2093, was put over by the author. Item 15, Assembly Bill 2173 by Assemblymember Bell. The current vote is 1-0. Senator Strickland, Onnested, Cedillo. Cedillo, I. Cox. Leno. Leno, I. Negrete McLeod. Pavley. Pavley, I. Romero. Romero, I.
It's got 5. That bill has 5 votes.
That bill has 5 votes. It is out.
Item number 16, AB 2199 by Assemblymember Lowenthal. The current vote is 3-0. Senator Strickland, Cedillo. Cedillo, I. Cox. Leno. Leno, I. Pavley. Pavley, I. Romero. Romero, I.
It's got 7.
That bill has 7 votes. It is out.
Item 17, AB 2221 by Assemblymember Bell. The current vote is 1-0. Senator Strickland, Onnested, Cedillo. Cedillo, I. Cox. Leno. Leno, I. Pavley. I'm sorry, Negrete McLeod. Yes. Negrete McLeod, I. Pavley. Pavley, I. Romero. Romero, I.
That bill has 6 votes. It is out.
Item 18, AB 2244 by Assemblymember Fuhr. The current vote is 4-1. Senator Strickland, Cedillo, Cox, Cedillo, I. Pavley. Pavley, I.
It's got 6.
That bill has 6 votes. It is out.
Item 19, AB 2300 by Assemblymember Emerson.
By Senator?
I'm sorry, Senator Emerson.
Keep calling yourself something genetic, right?
The current vote is 4-0. Senator Alquist.
Aye.
Alquist, I. Strickland. Cedillo. Cedillo, I. Pavley. Pavley, I.
That bill has 7 votes. It is out. Now, the next bill, file item 20 by the Speaker, AB 2352, we need a motion. So moved.
As amended, yes.
So moved as amended by Senator Leno.
Senator Alquist.
Aye.
Alquist, I. Strickland. Onnested. Cedillo. Cedillo, I. Cox. Leno. Leno, I. Negrete McLeod. Negrete McLeod, I. Pavley. Pavley, I. Romero. Romero, I.
That bill has 6 votes. It is out.
Item number 21, AB 2389 by Assemblymember Gaines. The vote is 3-0. Senator Strickland. Cedillo. No. Cedillo, no. Cox. Negrete McLeod. Negrete McLeod, I. Pavley. Pavley, I. Romero.
It's got 5 ayes.
That bill has 5 votes. It is out.
Romero didn't vote. She didn't vote last time either.
Item number 22, Assembly Bill 2470 by Assemblymember De La Torre. The vote is 2-0. Senator Strickland. Onnested. Cedillo. Cedillo, I. Cox. Leno. Leno, I. Negrete McLeod. Pavley. Pavley, I.
That bill has 5 votes. It is out.
Item number 23, AB 2540 by Assemblymember De La Torre. The vote is 4-0. Senator Strickland, Onnested, Cedillo. Cedillo, I. Cox. Leno. Leno, I. It's got 6.
That bill has 6 votes. It is out.
Item number 24, AB 2578 by Jones, Assemblymember Jones. The current vote is 1-1. Senator Alquist.
Aye.
Alquist, aye. Strickland. Cedillo. Cox. Cedillo, aye. Negretti McLeod. Pavley. Pavley, aye. Romero. Romero, aye.
That bill has 5 votes. It is out.
Item number 25, AB Assembly Bill 2645 by Assemblymember Chesbro. The current vote is 2-0. Senator Strickland. Cedillo. Cedillo, I. Cox. Leno. Leno, I. Negretti McLeod. Negretti McLeod, I. Pavley. Pavley, I. Romero. Romero, I.
That bill has 7 votes. It is out. Is that the last one?
This is the vote only.
Members, we had one bill that was for vote only. It was file item 26, AB 2042. Several of you already voted on it. The one amendment that was taken was to say that it allows plans and insurers to lower premium rates as long as cost sharing and covered benefits do not change for the enrollee. And also a few technical amendments.
Senator Strickland, Onnested, Cedillo, Cox, Leno. Leno, aye.
This is file item 26 for vote only. Okay.
Cedillo, aye.
It's got 6 ayes.
That bill, Senator Cedillo, you okay?
Yeah,
that bill has 6 votes. It is out. Thank you, members. I know it was a very long hearing. Meeting adjourned.